Welcome to the December 3rd, 2018 meeting of the Yarmouth Board of Health. And to get started, the first item on the agenda is the public comment. If anyone would like to come forward. The line looks short. Let's go to item number 2. This is a TikTok from Larry Dapsis from the Cape Cod Cooperative Extension.
Do you want to say something about?
No, go ahead. You can decide. I'll jump in at a later date.
Okay.
Just remember, we need you speaking into a mic somewhere. Otherwise, people at home are not going to hear you. So, and I don't want that to happen. We're really so happy you're here.
If you want to operate the slides, I'll mic up.
Yeah, we just don't want to miss it. And people at home really, want to hear it.
Okay, Amy, when I want you to advance the slide, I'll give you a cue. Oh, boy.
Thing is, though, let me just see if this works. Yeah, okay.
You didn't get a yes from her yet, Larry.
I know, she's being evasive.
Yeah.
Okay.
But do you want to just give a little background on yourself, the extension, what do you do?
Sure. I'm the entomologist for Cape Cod Cooperative Extension. I've been here for now about 7 years, and I'm working in a very different world than I was used to in my professional career. Prior to this, I spent 24 years in the cranberry industry with Ocean Spray, where I was the bug guy for North America. And when I arrived in this particular arena on tick-borne diseases, my eyes have been opened very wide in terms of, I didn't realize the dimensions of this problem and how it's changed so many lives. That's why our branded extension message on all of our printed literature is one bite can change your life, and I believe that. So our mission, our core mission, is all about prevention. Don't get the tick bite in the first place, because the first thing I tell people in my general public meetings is listen to what I'm telling you, and because if you get a tick bite and you're not feeling good and you walk into a doctor's office, that outcome is not certain, and that should frighten people, okay? So thanks for the invitation, and it's always good to kind of update boards like you on activities we've been doing, and we've been doing a lot over the last 7 years, and I think we've gotten a lot of visibility, including today's Cape Cod Times that I'll talk to. But I figured I'd start out tonight with a little bit of tick trivia, okay? You got to be on the cue, Amy.
I'm sorry.
All right.
She's new. It's okay.
Our friend the possum, not a friend in anybody's mind. And what I tell people is that we should embrace the possum. If there's ways to help possums, we want more of them. And here's the reason. Because in the tick world, they are Rambo. They are tick-killing machines. There's a property in animals called permissiveness that on animals, ticks can get to a certain load, and if the animal's capable of doing something like grooming, they will. So with mice, it's like 20 ticks on the ears and other animals. But possum, they do not permit tick feeding at all. And what they have calculated at the Carey Institute of Ecological Studies in New York, my colleagues out there, that a possum is responsible for over killing 5,000 ticks per week. So we could use a lot of those things out there. All right. I received a call from your new person, Amy, I think last August, and this is a postcard, and we received a grant from Cape Cod Healthcare, I think 5 years ago, and we mailed this to, I think, 160,000 households on Cape Cod. It was about a $25,000 project. So on the front side, it's got bold graphics, the one bite message, and if that's in your mailbox, it will get your attention. And on the back side, some very good bulleted practical information. So we launched it. We got a lot of feedback from people that they're taping it to their refrigerators and things like that. And when Amy contacted me, she said, that was a really good thing you guys did, but maybe that's a tool that we should bring out of the box and launch it again. And I thought that was a great idea. So we sent Amy the file. You guys took them to a printer, got them done, mailed them out in September. And for some short money, yeah, you reached, your 16,000 households here in Yarmouth. She launched it in September, and we had talked about, timing. And September is actually a good launch point because that coincides with the emergence of the next generation of adult stage ticks. So there's a couple messages here. One is beware. We have ticks here on Cape Cod that can mess you up. And don't let your guard down just because you're getting into the fall and cooler weather. What we like to remind people is that tick season started January 1st. It's going to end December 31st and start up again January 1st. So anytime you get temperatures above freezing and break in snow cover, you're going to have tick activity. And if you look at the data, you see cases of Lyme disease each and every month, okay? So it's a year-round problem. So this was, I think, in my mind, a good stint. So I asked our director of the health department, Sean O'Brien, to tell the members of the Health Agent Coalition, the Island and Cape Coalition, that what Yarmouth did, and we'd be willing to share this files with other towns if they want to do make a similar effort. So
Yeah.
good.
So that was good, and I just want to add to that a little bit that Amy was working with Cape Cod Healthcare, and the hospital on this, to work with a separate grant that we're able to get. And this goes back to, July, August that we're working on this to get the grant and approved and everything. So a lot of hard work went into that. And then we working with Larry at the county. So appreciate that. Is anything you want to say to it, Amy, at all, or?
Kudos.
Back at you. Okay.
Yeah.
It was good.
No, good effort, good initiative. I mean, I'm actually happy she remembered we did this project, which is good.
Good.
All right, here's something we did this spring. We purchased these acrylic racks that you probably see in a lot of places. They hold, literature or business cards. And so we bought a bunch of these, and what we loaded them with are these temporary tick tattoos that UMass produces. So this is a tool for parents to teach kids how to do a tick check because it shows what the ticks look like and it shows the actual sizes of the different life stages for all 3 tick species we have here on Cape Cod. We pressure tested this in the Monomoy school system before we did this. I brought this into 24 classrooms of grades 5th, 6th, and 7th, and it was a home run with the kids, and it was a home run with the teachers. And some of the kids were kind of funny. They're putting the tattoos on their cheek, on their forehead. But the kids learned a lot. The principal caught up with me on my last day and said he walks in between periods, between classes, and in the hallway, this is all the kids were talking about was the tick class. So we put these in all 34 libraries on the Cape, put them in all the senior centers, because what I'm learning is that older people really are interested in things they can do to protect their grandchildren. They're always worried about them. And we put them in all the major garden centers because ticks and gardening go hand in hand. So we replenished our supply. We just bought another 20,000 tattoos, and we feel it's a good project. So
Is that something we should work with the schools on also to get it out to our schools, them grades? Would that be helpful, or?
Yeah, it's something that we'd have to think about funding, how to pay for these things. For the 20,000 I just bought, I paid $2,500. So we'd have to dimensionalize how many and where we want to put these. But yeah, I think it's a great idea to do something like this in the school. I mean, when we did this in Monomoy, it was obviously a home run, but we don't have the resources to do it for every single school system.
Let me keep that in mind, because we'll be talking back to Cape Cod Hospital about a program that would cover the whole Cape.
Mm-hmm.
This might fall into that obviously you'd need more than 20,000 to
Sure.
cover the whole Cape.
Well, that's something we can talk about offline then.
Let's do that.
Okay, good idea.
Who's the initial connection to the schools? Is it the nurse that you were working with? How does that work?
Yeah, County Health and Environment has responsibility for education in the schools. That would be led by Deirdre Iverson, our county nurse, and I have the general public.
Okay. Thank you.
All right. I track the media daily, what's being written about ticks and how are they writing it and things like that. And I was aware that they found a new tick species in New Jersey last year, Asian longhorn tick. They found it on a sheep farm and it raised an eyebrow. Then this year they found it on another sheep farm in New Jersey in a neighboring county. And then before you know it, they found it in Virginia, Pennsylvania, New York, and about 6-7 weeks ago, Connecticut. And the headlines I was looking at were things like, new tick, suck an animal dry. Yeah, particularly small livestock animals, lambs and things like that. These things can, in big numbers, drain a lot of blood. But that's quite an alarmist headline. The other thing, A to Z, it can transmit anything. It's the implication here. Go back. The fact is that the diseases this thing is associated with in Asia have not been found in the United States. Okay, we have not found one single infected tick. Okay, and the findness in many states at the same time tells me this has been here for several years. It's just that people just started looking for it. In fact, if you look at the genetic analysis, it suggests that this tick has been introduced 3 separate times, okay? So it's not just a single introduction and it just spread. So it's been here for a while. So is it here on Cape Cod? We're starting to look at surveillance, but we decided to kind of get out ahead of these type of headlines because I don't want people here just like, wanting to move out of Dodge, because of, a suspected tick. So I contacted Cape Cod Times, and so we got the headline we wanted. It's on our doorstep, okay? It's in Connecticut. Maybe it's here, maybe it's not. But it's not time to push the panic button. Let's put this in perspective. This is a tick that's primarily a pest of livestock. It will attack people, but livestock is what it prefers. And we don't have big sheep farms or cattle ranches here on Cape Cod, but I did take note that people on the Cape are very fond of alpacas. So we also got coverage on the Chronicle. So create awareness. Yeah, if you see a tick that looks different than what you're used to seeing, like deer tick or dog tick, give me a call. And so we want to, make sure we're on top of the case. So we've initiated some surveillance. That'll pick up in the spring. What I'm gathering now from the different health agents is people, if you keep livestock, you're required to report that to the town. So I've asked for lists of those farms. And what I want to do is contact people that have livestock and just ask them, have you purchased livestock from out of state, like New Jersey or Pennsylvania? I think if it's going to reach here, Cape Cod, it's going to be through interstate travel of livestock animals. There's an outside chance it could be brought in by birds, but I think livestock is the more likely way that's going to be in. So we'll report back to you next year when we start finding it. But we started looking for this already.
Larry, excuse me, could you just describe what we would be looking at that would kind of help you, if we're calling you, what this guy looks like?
It's a very nondescript, rusty red tick. It's no distinctive markings, so it doesn't have that bright red abdomen like a female deer tick. It doesn't have that bright white spot like a Lone Star tick. It doesn't have those creamy beige lines like a wood tick or a dog tick. So you see something that's absent of any distinguishing markings, that's worth noting. And I already got a call from one person in Mashpee that she claimed she pulled 2 of these off her pooch. And I said, did you save them? No, I burned them. So I said, you destroyed evidence. Okay? So we want people to call us even if they suspect it might be Asian longhorn. All right. I work very closely with the Laboratory of Medical Zoology at UMass Amherst. They do tick testing and other research. That's Dr. Steve Rich on the left. He's the lab director. On the far right, that's Dr. Guang Zhu, his research associate and master Yoda of this lab, believe me. And in the middle, that's Emily, one of Steve's graduate students. One of the things that we're participating in is I spent last week at Deer Check-In Station, Goose Hummock Shop in Orleans. And what we're doing at this station, and today I was at the Joint Air Base. They have a deer season this week, and so I was at that check-in station today. And what we're doing is removing ticks off the deer. We're taking blood samples as well. There's a feeling, or in the medical community and the entomology community, that there are factors in deer blood that won't allow those pathogens to survive. Well, that's only really been studied with Borrelia burgdorferi that causes Lyme. So what we want to do is take blood samples and see if there's the presence of any of these pathogens, because now we have the ticks on them that would have transmitted the pathogens to the deer. And so are the deer harboring these things? Maybe not Lyme, but maybe some of these other things. Harvesting engorged ticks and keeping them alive, that allows UMass to bolster its colony, because they're going to allow these adult female ticks to lay eggs and allow those eggs to hatch into larvae. And there's at least one pathogen, Borrelia miyamotoi, that causes relapsing fever. And there's some evidence that there's the ability for transovarial transmission, so mom can pass this bug on to her kids. It doesn't seem to be the case with other pathogens, but again, the database is fairly narrow. So this allows us to get a very robust set of data out there. So we're getting this from this county, Plymouth County, my counterpart there, up in Waltham, out in Central Mass and Western Mass. We get a lot of people on this. Now, we still have, through UMass Amherst, a tick testing program. Now, the Cape Cod Healthcare has funded this through a grant to us for 2 consecutive years, but last year the grant money ran out fast. I mean, it's become a very popular program. So Cape Cod Healthcare has stepped up, and now they're directly funding this program with the university. So a standard panel test is normally $50. With this subsidized test, basically $15 for Cape Cod residents, and Cape Cod Healthcare hasn't put a termination date on this. It looks like they're going to keep this going forward until there's a larger, more stable funding base in place. But right now they're helping to keep this going. So for the price of a pizza, people are basically have the ability to get data on what they're potentially exposed to. And the medical community is starting to warm up to this, that now we have hard data. And in the case of these ticks, they'll give an estimate of feeding state. So this is a fully engorged tick that was on this 3-year-old boy. So plenty of time for transmission of these pathogens. And so it tested positive for Borrelia burgdorferi that causes Lyme. So without medical intervention, this kid certainly would have came down with Lyme disease. But tick was co-infected with Babesia that causes babesiosis, which is uncommon in younger people, but it can occur. And so what would the combination of these 2 pathogens in a clinical presentation look like? So it gives the doctor a better handle on what they should be looking for to fully evaluate their patient. And it's fast turnaround. Once they get the tick, you get your tick report in 3 business days or less. And unlike the human blood test for Lyme, this is 99.9% accurate.
Larry, okay.
Yeah.
There we go. I was just going to say, what's the percent of that you're finding?
Yeah. See, you were looking ahead.
Yeah, I was looking ahead.
So last year, this is a profile of all the ticks that were submitted on Cape Cod, and we're starting to build an interesting picture of the Cape Cod landscape. If you look at the pathogen that causes Lyme, we see ticks infected at a range of 21 to 41%. And Babesia and Anaplasma, lower, relapsing fever, even lower than that. So let's focus on those 4. The lower end of those ranges really are the upper to the mid-Cape, say up to around Barnstable. The higher end of those ranges are pretty much the outer Cape from Harwich, Brewster, and outward. And if you pair that up against with what we have for actually the incidence rate of Lyme disease on Cape Cod, particularly for the outer Cape, the infection rates and the incidence rates of Lyme disease line up pretty accurately. RMSF, that's Rocky Mountain Spotted Fever, and we threw that into the mix this year. And the reason was that we did have a case of Rocky Mountain 2 years ago, a 10-year-old girl in Brewster. And so of the 160-something dog ticks that we had tested, we came up with 0 detects on Rocky Mountain. So we know it's out there at a very low level, but it's worth monitoring.
How many ticks were tested altogether?
Oh,
Over the years, are we seeing a trend, an increased trend with people understanding, educating them that they can send the tick to college?
oh yes. Yeah, it's been ramping up. More people are willing to send a tick to college now. So I don't have the trend numbers, but I do know that, if you look at this 4 years ago, there were a few people that were testing their ticks. Once we were getting it subsidized testing, people are now diving in. Parents in particular, and this is an interesting observation, is that a number of parents have told me, Larry, I pulled a tick off my kid, sent it to UMass, and it came back negative. And that's peace of mind. They were just, they don't have to sweat bullets waiting, or 6 weeks, 6 weeks down the road, is my kid going to start being ill? And we don't know what it is. So in that regard, it's been a very positive benefit. The other thing I'll point out is that of those deer ticks tested on Cape Cod last year, 13% of them were co-infected. They were packing 2, 3, sometimes even 4 pathogens. And that's something we're trying to really make the medical community aware of, because this co-infection is something that we really have to pay more attention to than we have, I think.
Just interrupt for a second. You talked about $15 and sending your tick to college and all. What does a person who's listening now, what do? There's a tick, they remove it. How do they send it to college?
Sure. It's easy. The website for the lab is tickreport.com. There's an online submission process, and if you get stuck, there's a chat button, which they monitor like a hawk, so they're all about customer service. So that's on our website as a link, and we talk about that all the time, so tickreport.com. In fact, most of the questions I receive, from phone calls from people or emails is, how do I get a tick tested? And so we go through that very quickly, and people are very happy with the service.
That's great. Do we have a link on our website for the town?
I don't think so.
All right, let's check on that. Okay, to get to you.
All right. Speaking of websites, this is a project I just completed. I received another grant from Cape Cod Healthcare, where I spent the last 6 months scripting and producing 10 videos on everything ticks. So basically what I've taken is, one of my workshops, and I cut it up into 10 buckets, because when I do a workshop at, say, a library, not everybody's schedule lines up with the time I'm going to do a talk. So this is a way that people can kind of take this information in increments. So these videos are 6 to 11 minutes a piece, and so it covers everything from, tick identification and ecology, Lone Star, the new tick in town, demonstration of how to properly apply permethrin to clothing and footwear, how to do a yard spray, easy as, and there's one on tick testing, how to go online and get the tick tested, and what do the results mean, why these data should be meaningful to you. So we're very proud of how this turned out. We just brought it up on our website not too long ago, and it's already got about 1,200 views. Katie Brown at Mass Department of Public Health, they're going to post a link on their website for this series, and a person at CDC, they're now evaluating this because they see that their outreach materials are lacking, and they see this series of videos as something they may post on their website. So if we make it to CDC as a way to spread, yeah, it's all been good, and the feedback from people. In fact, I got a call last weekend from a man who had a follow-up questions on a video, and then he told me I was a rock star, and I thanked him, and he watched all 10 videos 3 times.
Binge watching.
He binge watched my series. So if you look at them, I think you'll get a lot out of them. We put a lot of work into them. We worked with Cape Cod Community Media Center in Dennis, so Channel 99. So they're now running this on cable as well. So we're out of the blocks and doing well.
And how do we get to them?
Our website, and if you guys want to put a linkage on your town website, we'd be happy to see it there. And we've been advertising it, so I've gotten some coverage in the media, including radio. So it's coming from Ocean Spray. I know something about marketing, and you put a product out there, it doesn't move on its own. You got to kind of give it a little nudge. And so people in Cape Cod Times and Alan Pollock at the Chronicle, they've been very, very helpful to support us.
It's YouTube?
Well, it's up there on YouTube. But we have, the easiest way to do it is to link to our website. Yeah, concert tick. So any other questions on what we've been?
On checking the deer, because that was the front page on the Cape Cod Times today, you're seeing the, I know you just talked about it briefly here, but a decrease in the ticks.
Yeah, that's not the headline I was looking for. I wanted to see it more about the research we're supporting through this effort, but when I was talking to Cindy McCormick, she said, how's it going? I said, well, it's going slower than I thought because we're finding deer coming in that have no ticks on them, which I didn't expect at all. And they're seeing the same thing in Plymouth County, in Central Mass, in Western Mass. So it suggests that maybe there's has been a reduction in the tick population. In talking with the hunters, they noticed that they were getting fewer ticks attached to them than in previous years. And in our surveillance, I tell people that tick populations, they oscillate, they go up, they go down. The headline, the concern I had for today's headline is that it suggests to people that they can be, kind of relax. And I'm saying just the opposite. It's no time to let your guard down at all. So I have a chance to talk about this on NPR Woods Hole tomorrow. So I just want to put proper context about what a lower number of ticks means. Maybe it reduces your exposure risk somewhat, but it doesn't eliminate it. And so that's why I'm telling people, keep with the tick checks, the permethrin-treated clothing and footwear year-round. This is interesting, but the research is even more interesting.
Why don't you share some of the basics again about the products, what to and wear on your clothes or your skin? These are very basic, but there are people listening.
Yeah,
Need to know.
check out my video.
Right here now, just like for 1 minute, just tell people.
Yeah, what I found when I started working with permethrin 7 years ago is that I evaluated it, and what I found was that it doesn't just repel ticks. Permethrin is repellent to ticks, but what I found is that if a tick gets exposed to a treated surface for 60 seconds, it's guaranteed to meet its maker. I mean, there is no way around that. It's the most effective tool in the box. So it doesn't just repel, it kills. So several questions become, raised, like, where can I get this? Well, 7 years ago, you couldn't hardly find it. So I convinced all the major garden centers on the Cape to carry it. They are. And in talking with them, the last few years, they're out of stock more than in stock. So it's flying off the shelf. So the elephant in the room is if you're telling me to put my kids in clothing treated with this chemical, Is it safe? And so I walk people through this in my workshops and in my video. It's the active ingredient that you would slather on an infant for scabies mite at a much higher concentration, and it's the active ingredient used to treat head lice. National Research Council is a pretty heavyweight organization, and they were wondering about long-term exposure because this was originally developed for the military. So in their exposure study, they looked at people wearing permethrin-treated everything, wearing it 18 hours a day, every single day for 10 years, and when they rolled up that aggregate exposures, they saw no reason to expect an adverse effect. So on one hand, when I look at what I think is a relatively very low risk cup for exposure, and I weigh that against the consequences of one of these tick-borne diseases, that is easy math. And the last thing I tell people is that kids age 5 to 9 have the highest incidence rate of Lyme in the state. So as parents, whatever we've been doing up to this point in time clearly is not working. We got to rethink the game plan. That's my 1 minute.
What time are you on tomorrow morning?
The interview is at 10, so I don't know. I don't think it's going to go live. It's with Catherine Ident, their science editor. I've worked with her. Yeah, she's very, very good. So she'll probably tape it and do her editing magic, and she'll probably run it fairly quickly because it's a time-sensitive story.
Right.
But they're good down there.
Yeah.
On the possums, what can we do to increase that population? That seems
Adopt a
like
possum?
adopt a possum.
Can we
Well,
Christmas present?
Bruce, I'm your county bug guy, not your county wildlife manager. We'd need someone with different talents than me. But I thought I'd point it out that, as part of the ecosystem, they play an important role for us.
You said 10,000 a day, a week?
5,300 a week. You got to go back and relook at the slide. Yeah, 5,300 a week, which is astounding.
It's mostly protein? What is it?
They don't tolerate any amount of tick feeding, so they're vicious groomers. They're kind of like cats, whereas a dog, they're just happy to be there in the moment. They don't care about how many ticks are on them. But possums, my colleague Rick Osfeld told me that you have a caged possum, put 100 ticks on it in the afternoon, come back the next morning, they're all gone, and they've eaten them. They don't just groom them off, they eat them. So, to prove that out, I wouldn't want to have been the graduate student having to evaluate possum poop, but that's how they did it.
Okay, details. It's good.
It's a good pet to have in the yard.
Yes? Any other questions? Anyone? Thank you.
Thank you.
Very good. Thanks for the invite, and hope to come back at a later date with more interesting news.
Awesome talk. Okay.
Absolutely, yeah.
And enjoy the videos.
Yeah, thank you.
Good job, Ian.
Thank you. Thank you for your help.
You're more than welcome.
Good stuff. Thanks for coming in. Appreciate that.
Thanks for the invite.
You got your thumbs on that?
Yep.
All right. I'll stay in touch with you. I got in touch with healthcare. Cape Cod Hospital.
Mr. Murphy. Okay. You all right?
Yep. If you were going to go and talk to him, that would be fine. Or you can stay to the meeting.
Okay, thank you.
Okay. Just putting that option out there. I know it was a tough display over there. Appreciate that. Okay.
Yeah, so Director Murphy, we have like 5 updates.
5 updates.
You're on for a
The board
long
wanted a few
time.
updates the last couple meetings, so things are
Okay.
working well. First update is the fire department homeless for the holidays. And I think we have a little flyer that the TV can zoom in on as I go over it, but it's the 17th annual Homeless for the Holidays. It starts this week, December 5th through 9th. And it's benefiting the Yarmouth Food Pantry, Caitlin's Closet, and Toys for Tots. It'll be set up on Route 28, right where it has been by Old Lady of the Highway Church, right by Cumberland Farms and the South Yarmouth Post Office, and encourage people to stop by and just drop something off, or just stop by and say hello and give them some encouragement. I know, Charlie, are you bringing your fire truck down?
Oh, yes.
You want to say anything about the fire truck? What year it is?
It's 1956 Dodge Power Wagon. It was a brush breaker for the town of Yarmouth for many, many years.
Yeah,
And one of the retired lieutenants told me that I was going to put it back together.
good.
Every year it goes to this, yes.
So come down, get your picture with the fire truck.
Yep.
Bring a can of goods, picture the fire truck, ring the bell.
Yeah, I leave it there for the whole 4 days.
Yeah,
Great.
It's right there.
Nice.
so there we go. Good. So, just trying to get that out to the public. They do a great job over there, and looks like there might be a little twist in the weather towards the end of the week. It's not going to be as warm as today, so they'll be challenged over there, I think, but they do a great job. Good.
Yep,
Okay.
okay. Next up, polystyrene recycling in town of Yarmouth.
Yes, that was one thing the board wanted to keep tabs on, is how that's progressing. I did check with the recycling committee, and as you can see from the email that I've included in the packet, that the committee's put it off to the following year, 2020, to get it to town meeting. They feel they need to get out and probably do some more education into to the public to get it through. I believe they've had some comments about it going through and what would be entailed in it. Would it entail just polystyrene, or would it get into some of the plastics? So I think they want to just spend it more time of how they want to present it. I said they could get on the Board of Health agenda maybe in February-ish, and just, tell the board. They do have a draft that they would like to go forward with, but they haven't brought it out to the public yet. So there's really no other towns doing it. I believe Dennis has adopted it, but they weren't sure how effective that's been, or where that's in the regulation period. So there wasn't a lot of stats that they could present me that I could give the board of, who's doing it on the Cape or across the state. So there'll be more on that, and I think we can put them on the agenda just to
Good.
get an update from that.
Next update, the Yarmouth Substance Awareness Committee.
We
It's about
jump
the
by the
annual stickers, yeah.
tobacco cap, or you want to go down to,
Okay, yeah,
no,
I'm sorry.
either way.
I don't care.
Well, go in order. Tobacco cap.
Sure.
The board had a lot of discussion at the last meeting of a person that was in process of going a tobacco license store, convenience store that was closing, and who would be purchasing the tobacco license from that store. And the board kind of went back and forth, and we wanted to make sure that the wording was correct in our current regulations, that I think we could cover a couple scenarios. So the chairman, myself, and food inspector Phil Reynolds sat down for a while, and we kind of went through a couple scenarios, and we feel the wording that we have in the regulation should be sufficient. And I think one of the key wordings within the regulation was the word purchase, that if a retail store was going to close, somebody could purchase it from them. It's not when it's turned into the health department. They're not purchasing it from us. When it comes to the health department, that's when it's finalized and it's capped.
Before the store is closed.
Correct. So if somebody wanted to purchase before the store closed or before they stopped doing tobacco, they could do that. So I think we went through a half a dozen scenarios, and we felt comfortable for now that the keyword purchase covers us for what they could do. The one that had just happened, the store was a chain store, and the chain already had their name on the license, so they didn't really have to purchase it because they were indirectly already on the license. But it gave us a good chance to look at a half a dozen scenarios, and we feel comfortable that we have most of them covered now. So, and then if we look back, we really haven't had turnover in retail stores coming in or turning anything over in the last number of years, so it's not something that's going to come up frequently, but when it does, I think we're going to be comfortable. The sticker shock through the Yarmouth Substance Awareness Committee, myself is on, Amy's on also. I know Hillard, you've been to a few of the meetings. 2 weeks ago, did their third annual putting stickers on the bags at the 9 liquor stores that we have in town. There was very good cooperation between all the stores. They look forward to working with us each year. And I put in the packet, parents who host lose the most. Don't be a party to teenage drinking. It's against the law. And I want to say we did 7,000 bags. There we go. And we had help from several high school students, explorers in the police program up at the school. We also had myself, Amy were there, a couple people from the committee, senior senators were there, and it was a lot. I mean, 7,000 bags. I think we were there 3 hours, would we say, about 3 hours, and it went very well. And I think it's nice working with the 9 liquor stores in town that, you know, also embrace the idea, and they want to support it. And we want to do it at this time of year as it goes into the holidays to try to keep the concern out there. So 7,000 bags. The stores provided the bags to the committee, so we put them on, then we delivered them back to the store. So probably between now and the year, and probably even after the first of the year, you'll see a sticker on the bag. So that's one of the big things the Yarmouth Substance Aware Committee does each year. So they're and they did present this to the selectmen as an update also. So, but they also appreciate the board's action, and we did pay for some of this through our substance awareness grant that we had also towards the stickers. And we also worked with Gosnold. Anything you'd like to add at all, Amy? Or?
Just that it was at Gosnell. Gosnell's been doing this for quite a while with Falmouth, Mashpee, there's a couple of towns that do this.
Yeah.
Usually we try to coordinate the same date.
Yeah. Good.
And next on the agenda is the newsletter from Public Health.
Yes.
It's what Yarmouth has been up to, and it's largely based upon your effort here.
Yes, well, it's a group effort within a department, and we had Edie come in 2 weeks ago or last time to the board to tell us what she was doing as the board's partnership with Duffy in she was going to be the new navigator, working with people that have substance abuse or wanted to have support or guidance as they go through the system, or helping. And we're starting that program up, and we have stands, flyer stands around town at the libraries and so forth. But I had talked to Public Health about the program we have going, and it talked to the people in the regional, and it made its way up to the Commissioner of Public Health, and they added it to their November newsletter. From the Public Health, they mentioned the Yarmouth Board of Health offers Recovery Support Navigator program. So I think it's a good step for the board to be recognized by doing that, and it's just one of many areas of addressing the opiate education. So I think it's a real kudo to the board that we took that, and the selectmen for providing the grant to go forward with that for, looks like a 2-year grant.
Next on the agenda is approval of minutes, which on the agenda looks like a different date. We're going to look at the November 19th minutes, I think. Is that correct? Yeah, not what the agenda is saying. Correct. So, yeah, which is fine. So hopefully everyone got a chance to take a look at it. And anyone have any edits, changes? The most recent one should have been in front of you when he came to the meeting.
Right. You want to just explain what we put on we added one sentence to the agenda minutes.
Right. There was one on bike trails updates. It's the first page, number 3. Basically stating a very significant number of adult cyclists do not wear helmets on the bike path. It's like the 4th line down on that. Is that the only one on that? And the other point was second page, number 7, wastewater, and that had to do with Mr. O'Brien stepping down, and he's resigning from the board, as well as obviously stepping down from the wastewater advisory board. So they're really, so 2 boards that he's stepping down from. That was the only edit that I had on the second page. Anyone else? Okay, you want to make a motion on the minutes?
Move that we approve the Board of Health minutes for November 19th, 2018.
Is there a second?
As corrected?
That's correct.
Yeah.
Second.
Anything else, discussion-wise? All in favor? Say aye.
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 Minutes are accepted. That's great. Number 9. No?
Is there anything on the wastewater committee? I think you have a meeting coming up, Charlie, that,
December 11th.
okay, so at the next meeting, I guess you can give us an update on,
Yeah, December 11th.
yeah, wastewater then. Okay, great.
On to old new business. One thing I have certainly is our next meeting, right?
Yes.
The date we decided would be January 7th?
Yes, right now, there is no items pending for septic repairs or variance request. We have the holiday coming up and then New Year's, so I think January 7th, we'll have some updates and possibly interviews for a Board of Health candidate. We might have 1 or 2 available, so we'll do interviews at that time.
Okay. Anything else that's old or new?
No, we're good.
Anyone else?
Just, Christine, when you do the minutes for this meeting, it was probably just a typo, but it's Cape Cod Cooperative Extension rather than extensive.
Okay.
Good.
Anyone interested in adjourning at this point?
I move that we adjourn the meeting.
Second?
Oh, boy.
Good. All in favor, say aye.
Aye.
Aye. Adjourn. Thank you, everyone.